Good evening, ladies and gentlemen. Welcome to the December meeting of your Louisville Town Council. This is our final meeting of the year, so glad you could be with us. If you're watching on TV6, watching on Facebook, or watching on the World Wide Web from around the world, welcome to the Louisville Town Council meeting. We're glad you're with us this evening. We'll begin our meeting this evening with an invocation. And Bo, would you please lead us in that?
Be glad to. Thank you. Let's pray. God, our Father, we come to you this evening giving you thanks for your many blessings of life. We give you thanks for a wonderful year that we have had with its own challenges and difficulties, but nevertheless, a time to be together. And for that, we are thankful. We are thankful for this town, for its citizens, for the staff, and for the elected body that serves this town so well. And we give you a special thanks for this special time of the year, when people from many different faiths and beliefs come together, loving one another and giving thanks for the greatest love of all. We ask your blessing upon this time of meeting, that you will give strength and courage to those decisions that need to be made tonight, and wisdom during the course of this meeting. And when the meeting is over, we ask you to be with us in the coming days, months, and years. We ask all these things in your holy name. Amen.
Thank you, Bo. Ladies and gentlemen, meet your town council this evening, starting with Mr. Smitherman.
Here.
Ms. Welch.
Here.
Ms. Hunt.
Good evening.
Ms. Foster.
Here.
Dr. Sadler.
Here.
Mr. Franklin.
Good evening. Hi, I'm here.
You sound uncertain about that, Mr. Franklin. Council members, our consent agenda is pretty straightforward this evening. These are items that come before the council of routine nature. They are our financial reports. They are our minutes from past meetings. Generally, we take this as a group. However, if any council member wishes to pull one of them off individually and discuss it, they can do that as well. If not, we'll entertain a motion to approve the consent agenda.
Mayor, we need to approve the regular agenda if we haven't done so.
Well, I got new glasses, reading glasses, and there's the problem right there. Okay, so turn them over. There we go. See what that does for us. Very good. So let's take a look at the agenda. There have been some changes other than the leaping forward and missing that completely. On 3A3, we will not have a report tonight from our annual audit from Gibson and Company. Not for any fault of our finance director, because she did everything she could to get it through the LBC, right? LGC, the local government commission, and they couldn't quite get it together and get it to us this evening. So we will have that for our January meeting. We do have a couple of additions, please, under 12 new business. This would be new business C. And we'll just call that mask up. New business D, we have a resolution for your approval on our memorandum of agreement with the school system to do remote learning center at our community center. And item 12E, which is a resolution for a lease for the community center that we will have between the organization that runs the programs and the town of Louisville. Ms. Walker, have there been any other additions or changes since this went out?
No, those are the only ones that I have.
Very good. Council members, if there are no changes or additions, I'll entertain a motion to approve the agenda.
Motion to approve.
Mr. Smitherman makes the motion. Ms. Hunt makes the second. Any discussion? Mr. Smitherman.
Aye.
Ms. Welch.
Aye.
Ms. Hunt.
Aye.
Ms. Foster.
Aye.
Dr. Sadler.
Aye.
Mr. Franklin.
Aye.
Mayor's aye. That's unanimous. Thank you very much. I'm not going to give you the spiel on the consent agenda because I already did that a few minutes ago, but just needed to say that we need a motion to approve the consent agenda.
So moved.
Mrs. Welch makes the motion.
I'll second it.
Mr. Franklin makes the second. Any further discussion? Mr. Smitherman.
Aye.
Ms. Welch.
Aye.
Ms. Hunt.
Aye.
Ms. Foster.
Aye.
Dr. Sadler.
Aye.
Mr. Franklin.
Aye.
Mayor's aye, and that approves that. We are very fortunate, council members. I think at our last meeting, we had lots of questions about what's going on in our community regarding COVID-19 and the efforts that are underway to try to deal with that. We're very fortunate tonight to have Joshua Swift, who's the director of the Forsyth County Health Department. And Joshua, you took my advice. You're not wearing a coat and tie this evening. It looks like you're a little more informal, so that's great. And we have Chantel Robinson, who is the Assistant County Manager. Welcome to you both, and thank you so much for being here. So I'll turn it over to Chantel or turn it over to Joshua, whichever one you want to take it.
Well, good evening. Yeah, good evening, Mayor Horn and Mayor Pro Tem Foster and council members. Thank you so much for inviting us to speak with you this evening. I am Chantel Robinson, the Deputy County Manager here for Forsyth County. And in that role, I serve also as the Health and Human Services Director, where I oversee the Departments of Public Health, Social Services, and some other departments within county government. As Mayor Horn stated, I do have with me our Public Health Director, Joshua Swift, and we'll both be presenting tonight and are here to try to answer any other questions that you may have. So I will go ahead and get started, Joshua, with the first slide. And so just real quick, kind of general COVID-19 overview. As you are aware, I mean, nationally, statewide, and even locally, our cases really are just not good. We are not trending in the right direction. And it's really just becoming very concerning for us. And so we're continuing our outreach and education efforts to the community to continue stressing the importance of the 3 W's, washing your hands, wearing a mask, and socially distancing. That is really, really important, and we don't want people to let their guards down. We are also collaborating with the Chambers of Commerce. Deetra Miller, Louisville, Clemens have really been very helpful to us to assist us with also educating businesses. We do know that some businesses are doing a great job enforcing the governor's orders, and unfortunately some are not. And so we really want to praise those who are doing well, celebrate those, and really hopefully have some positive impact on those who are not. That is really important for us. We are continuing to test in the community. The Department of Public Health hosts community testing events at no cost for anyone, whether you have symptoms or don't have symptoms. We know the town of Louisville has hosted us a couple times at Shaliford Square, and we appreciate it. That is a great site for testing. As we are moving to colder months, we are looking for more indoor drive-through locations. And so we will be at the fairgrounds at least twice a week, at one of the ambulance bays in Watown at least once a week. And then we're also at one of the YMCAs. And so I mentioned during a meeting that Mayor Horn was in this week, is if the town of Louisville has any sort of indoor drive-through spots that you have, we would be happy to come out and do testing. At the fairgrounds, we are literally in a large cattle barn. So you can think creatively. We're open to ideas and suggestions because we want to make testing available to the entire community. Of course, if you are symptomatic, there are lots of testing locations throughout the county at the various clinics and pharmacies and those types of things. And so our community is getting tested, but we did want to tell you about our specific community testing events. In terms of case investigations and contact tracing, as you can imagine, our case rates are, because they are so high, our public health staff is having challenges now really keeping up with our case investigations. And what that means is individuals who test positive for COVID-19, they should be first notified by the test location who gave them the test, whether it's a provider, whether it's a testing site. And so they should be informing those individuals whether they're positive, and typically the public health department will follow up as soon as we are notified. We are at the point where we are not able to contact everybody who is positive. The state has provided us with a list to prioritize individuals, and so we are doing that. This is a statewide issue. Certainly it's impacting Forsyth County a lot because we are a larger county. We have asked for additional staffing from the state. We've reallocated our own internal staffing, but we do want the public to know that if you do test positive for COVID-19, you do need to isolate per the CDC guidelines, and it's also important for you to notify your close contacts as well. We will continue to contact as many people as we possibly can, and hopefully we can get caught up. But the reality of the situation, I know a couple days ago, we just had almost 400 cases. It is becoming very challenging for our team, but they are working hard every single day. This week, we did move from being an orange county within the state system to a red alert. And that essentially just means it's based on the number of new cases, positivity rate over the last 14 days, as well as hospital impact. That was no surprise to us. We certainly were expecting to be on the red list, and there are lots of counties that are on there. But some guidance on if you are in a red or orange county is to ensure you limit mixing between households and minimize the number of people in your social circle. Avoid settings where people congregate. If you're patronizing a restaurant, really considering to order takeout. Individuals who are high risk should consider staying home as much as possible, and really just reducing public interactions to mainly essential activities. Joshua will speak in a few minutes, just kind of the types of cases that we are seeing, but at this point, it really is just widespread community spread. And so it is important for everyone to adhere to the guidelines. I also wanted to mention, as I'm sure you're aware, is the governor's executive order. The executive order 180 went into effect on November 25th, and that stated that face coverings are required in all indoor settings if non-household members are present, regardless of the distance. And if face coverings are required outdoors, if you're unable to maintain 6 feet. Face coverings in gyms, restaurants, unless they're actively eating and drinking, are required, and retail businesses with 15,000 square feet or more must have a worker at each entrance and maintain occupancy requirements. And then, of course, Executive Order 181, that was just, that will be in effect tomorrow at 5 p.m., adds that most businesses must close by 10 p.m. And there is a curfew, which generally states that citizens should stay home from 10 p.m. to 5 a.m. That does expire in 4 weeks on January 8th. We'll see what happens. And obviously, there's lots of caveats in between that. But the real message for us is that we are leaning on our citizens to continue to wear masks and hand wash and social distance until we can really get full traction of the vaccines. And so at this time, I'll turn it over to Joshua, who'll give you an overview of kind of the types of cases we're seeing, the demographics, as well as our vaccination planning.
All right. Good evening, everyone. I hope you just a sound check to make sure you can hear me okay. Thank
Excellent.
you, Mayor Horn. So we are seeing, you can see our case count, and this was as of December 5th, 14,548. Just report these slides our epidemiologist, Dr. Levette Miller, puts together. And even just since this was done on December 5th, now 5 days later, our case count is at 15,686. So we have, in the past 14 days, had almost 3,000 cases, 2,986. To put this in perspective, we have on our forsyth.cc /COVID update, we have a dashboard, and you can get our daily count, but any statistics that you want, you can get our cases by age down to how many 10-year-olds, how many 20-year-olds, each age. Also, you can get by race, but you can also get cases by month. And to put it into perspective, early on, we had, our first cases were in March 12th was our first 2 cases. These were, and then slowly we had a few in April, a few hundred, May, in June and July, though we had over 2,000 cases each month. But then we got into a lull in August and September, where our average daily case count was around 30 to 35 cases per day. Now, in November, we had over 3,000 cases, and in over the last 14 days, we're averaging 213 cases per day. So just some numbers to put it in perspective. And then the last thing I would mention, just a little bit of a looking backwards to catch you up. We started our mass testing in late June throughout the community. We've accelerated that. We had the testing that was already mentioned at Shallowford Square. We also went to Kernersville because we saw those 2 zip codes were areas that needed more testing. Early on, we focused primarily in the city of Winston-Salem, primarily in 3 zip codes, 27101, 27105, 27107. Those are primarily east of 52 in our highly historically marginalized areas. But we're seeing, as Ms. Robinson said, we're seeing this now all over the place. Early on, we had a huge amount of Hispanic individuals that tested positive. And as you can see by our statistics, we are now that makes up 28% of our cases, where our cases in the white population is almost 39% and African American is 19%. But that, if you could look at that over the last month, it pretty much just mirrors the population of our county. So that was an early bump. But as I told people early on, because people were saying, well, this is just a problem for this population or this area. It's like, no, this can and will affect everybody. And I think you can all, and if I ask for people to raise their hands, I'm sure every one of us can think of someone we know that's had COVID. And I just got a text from a classmate who said that one of our classmates, someone that was a few years ahead of me at Elkin High School, a small school, who died in his mid-40s with complications from COVID. So it's, this has the potential to affect all of us. But I would say in looking at this, it's broken down by gender, race, and age. A big concern we have is that young population, that 15 to 45. You can see that makes up almost, I believe, a little over 50%. And that's the group that has, they're going to have less complications usually, but they're going to have a higher risk of having more contacts because that's your school age and your working age population. So we're very concerned about those individuals that have less chance of complications, but spreading it to those that are higher risk. You can see from this chart the number of individuals who are hospitalized due to COVID-19 in Forsyth County Hospital. So again, this is Forsyth County residents who are in Forsyth County hospitals. We're at 99. Way back in that lull of August and September, we got down into 19 or 20 was all that we had in the hospital. And again, I would say this is not, our hospitals have a catchment area that's very wide. That's Northwest North Carolina, Southwest Virginia. So they're drawing lots of people in. And as I told the commissioners today, obviously a concern is for those people with COVID, but, having capacity to make sure we can, if there's a car wreck, if there's a heart attack. So, this is a strain on our hospitals during a time when they normally see an increase due to the cold and flu. Next, this is our death rate for COVID-19. Overall, we have averaged between 1.4 and 1.2% of COVID cases that resulted in death. So this went over the last week to 2 weeks down from 1.3 down to 1.2. We have had so far as of that date, December 5th, we had 171. We've had more since then. As of today, we were at 178 deaths. Out of those 178 deaths, 86 have been in long-term care facilities. So just right at half. That was something that we focused on very early on. As soon as our schools closed or went virtual, in mid-March, we took school nurses especially, and we repurposed them. And we especially had a team that focused to educate our long-term care centers, because we knew it wasn't when, but if, not if, but when they would get cases. Early on, we saw the majority of cases in people that had traveled, but we knew that our most vulnerable population was in the long-term care centers. Some other statistics you can see on the screen as far as our deaths broken down by age is overwhelmingly in our population that's over 65. We can even further break it down and see, especially as you get older, over 75, over 85, that is a higher percentage. And then you can see the breakdown by race and ethnicity as well. A concern we have is especially in our African-American population, more complications, more chronic diseases that could lead to further complications and more risk of hospital stay or death. This next slide, yeah, it looks at our deaths over time. And again, this is just, the deaths just keep adding up. So in September the 5th, we had a total of 82 deaths. And you can see now, as of December the 5th, a total of 171 deaths. So this number keeps creeping up. And again, it's just something we're wanting to keep a watch on. And again, I go back to that younger population that has it. The majority of our cases, that is my biggest concern, is them spreading it to our individuals with either chronic conditions, no matter their age, or individuals that are older and higher risk. And a few more slides. This is our 14-day case count of our new cases per 100,000 population. So basically, it's what you hear. You see the slide, the line. It's our incidence rate. And so we looked at this. This was a metric that came out from the CDC. They wanted us to look at our incidence rate and then our percent positive test. So how many you test 10 people, how many people are positive? That was for the CDC. They recommended those metrics for schools and reopening to inform the school system. So we have taken that information. We share this weekly with the school system, but we also believe this is very telling for our general citizens. So you can see that in late September, early October, when we looked back 14 days, we'd had 362 cases. And then our incidence rate, that put it at 94.7 per 100,000. As you can see, each week, our epidemiologist goes back and looks at 14 days. So it's overlapping over top, so we can keep it, as consistent as possible. But you can see that this number is going in the wrong direction. You can see that our incidence rate now is right at 750 cases per 100,000 over the past 14 days. So, and then this next slide shows that percent positive. So from 12/5, looking back to 11/22, there were 15,190 individuals tested, and that put our percent positive at 18.9. This lower risk was for the school system. Back in 9/20 to 10/3, we were at under 5%. That's the number we've been shooting for some time. Back in May and June, we were in this 18, 19, 20%, June, July, and then it went down. And then you can see now it's crept back up and it's kept going up. It was at 20% mid-November to late November. Now it's went back down pretty much from 20% to 19%, and we're hoping it keeps going down. But that obviously is a concern and something that we are looking at, because some people want to say, well, there's more cases because you're testing more. But when you look at the number of that percent positive as it goes up, that just shows that there's more spread in the community. This next slide is the next two slides. And these are my last two. I just wanted to talk real quickly about something obviously that's on our mind is the vaccine. That's something that we're, and this is changing and changing fast, but we've been planning for months. The Department of Public Health working with both hospital systems and emergency management about how we would, what we would do when we get the vaccine, not if, but when. So what the state has rolled out is a phased approach. Phase 1A is frontline healthcare workers at risk of high risk of exposure and long-term care center patients and staff. Then phase 1B is adults at the highest risk of complications from COVID-19, as well as other first responders and individuals, law enforcement. Phase 2 and beyond, you get into more targeted population groups and more providers offering vaccine. If any of you remember H1N1 in 2009, 2010, I was a health director in a neighboring county. And at that point, the vaccine came primarily through the health departments and we distributed it to partners. Well, and even before that, it went from the vaccine provider to the feds to the appropriate state. Then the state distributed it directly to the health departments. So there was, and that was a lot of time. So now this is being shipped directly to providers. All 100 local health departments, which includes us, have signed on to be a provider. 115 hospital systems have signed on, and they're still bringing more. Pharmacies are expected to come on, as well as other community clinics and federally qualified health centers are coming on. So there's going to be, there should be more vaccine available. The thing is we have to get through these early stages. They're looking at our hospitals possibly getting vaccine the week of the 14th and 15th. There's a good possibility that we in the health department could have some vaccine that week before Christmas. So this is changing rapidly, but we're very excited to see the vaccine. And as you've probably all read about in the news, you know, the two vaccines, Pfizer and Moderna, with a 94 and 95% effectiveness. Over 70,000 people have been involved with both vaccine trials and the vaccine trials. They've also been very intentional to involve individuals, bring individuals in those trials from diverse backgrounds. Some things that we and the hospitals are looking at is the temperature and storage for these vaccines. The Moderna vaccine is just like a regular vaccine. We put it in the freezer, similar to chickenpox, but it's this Pfizer vaccine, which is ultra low cold vaccine. And what we're hearing is those shipments will primarily go to the hospitals, which have the capacity. One thing you've heard is the 2-dose schedule. One is Pfizer is 21 days apart versus Moderna, which is 28 days apart. Now that poses some challenges logistically, but when people get vaccinated, they will be given a vaccine card, which tells them the date that we'll have them come back for their vaccine. Plus we'll be doing media reminders. And then you can see some information about the type of vaccine and then the safety. So that concludes my comments, but I would be happy to answer any questions.
Dr. Sadler.
Thanks for the presentation. I've got 3 questions. The first question is, how do you define who is a healthcare worker at high risk?
And I'll just go ahead and read what has been put out from the National Academy of Medical Framework for Equitable Allocation of COVID vaccine. So this is their framework and the North Carolina Institute of Medicine's Vaccine Advisory Committee. So it speaks of, one, any activity that is at high risk of aerosolization. So somebody that does intubation, suctioning, invasive dental procedures, CPR, and items like that. So those are so basically you're looking at those frontline healthcare workers.
So from what you just said, anybody that does an invasive dental procedure, I just happen to be a dentist by training. I'm essentially retired, but when I hear that, I'm not really sure how you or someone who's going to be responsible for administering these vaccines will determine what an invasive dental procedure is. Is there a list of those things?
Well, we don't have a list, but that under the second bullet, it includes population. So it says high risk of exposure by those caring for COVID-19 patients. Second bullet under phase 1A, population includes nurses, physicians, respiratory techs, dentists, hygienists, and then it goes through others. So yes, it does, per this listing, it does have dentists. I think that the challenge we have with is, again, in those early phases, trying to prioritize the priority groups. Even if you're first priority, prioritizing within that group. We know that Novant and Baptist are going to really handle their frontline staff. And then our goal in public health is to work to find those that are not covered by Novant or Baptist at this time.
So the second question I've got is, are you finding many people in the population who are hospitalized who believe that this is a hoax?
People that are hospitalized that believe it's a hoax?
Yeah, because what I'm hearing on television from time to time is that they're in Tennessee, for instance, they are treating COVID patients who are about to be intubated, for instance, who are saying that they don't believe that it's COVID, that it must be something else. Are you seeing any of that in this county?
Well, that would be a great question for Dr. Ohl or a Dr. Priest with Novant. But most of the time, I mean, what we're seeing anecdotally is those that have had it are on the other side that are like, this was real.
Right.
This was not the flu. This was very severe. I'm sure there obviously are outliers, and the media likes to draw attention to that. But the people that I have heard from that have had this are very have changed their mindset. But unfortunately, there are a lot of people that have not had it that are not convinced. And
Yeah, that leads into my next question is compliance with the 3 Ws. Is there a sense of what that's like in this county?
anecdotally, I think it's probably 75 to 80% of people are doing what they're supposed to. Carnegie Mellon has some research where they've looked at analytics through Facebook and have actually done some surveys, and they're showing, and you can break it down by Forsyth County, and it shows we're at 89 to 90% of people are wearing masks. So I think my concern with this is this draws on, we're almost to the 9-month mark, is people that were doing the right thing are getting tired. Maybe not so much wearing the mask, but the especially this time of year with not the large gatherings. That's a tough one where we're social creatures. We like to get together for Thanksgiving and the holidays. And then you have individuals that haven't been doing the right thing, and trying to communicate to them and get them on board. And I think that is the biggest challenge that I wrestle with every day.
Thank you. Any other questions?
Thanks.
Thank you, sir.
Ms. Hunt?
Yes, thank you guys. Fantastic presentation. Chantel spoke earlier in regards to drive-through locations in various locations. Have you guys considered the fire departments? And if you have, has that been excluded or included for one particular reason or another?
So we have been looking at various fire departments around the county. And so some of them have like bays where you can like drive through, truly drive through. Some are you can just pull in, some aren't quite big enough. And some fire departments may or may not be interested, but we are looking at all the fire departments. The reason that we ended up easily being able to do EMS is because we very much, obviously emergency services is a county department. So we just invited ourselves there. Fire's a little bit more challenging, but we certainly will be exploring that more.
And then just to piggyback on that, Chantel, you also referenced like if someone has a barn or a large, are y'all going into the private areas in some cases where there is that capability?
So we really haven't, because honestly, we really don't know about them, right? I mean, what we know is more on the public side. And so the barn that we are in at the fairgrounds is like their cattle barn, it's their livestock. And so there's still pavement in it. It's really big. It's like, 4 entrance exit points. So great ventilation, as well as the ability to really be able to heat it with portable heater. So it can't just be necessarily any barn, but we have not explored private because honestly, we're not aware of any.
Okay, thank you.
Ms. Welch, I think you had a question.
Yes, thank you. Mr. Swift and also Ms. Robinson, thank you so much for coming tonight. It's very, very helpful. I had a question. Are either one of you, are you responsible or do you work with our local sheriff's department with our businesses? Can you tell us if Louisville's businesses, especially restaurants, are complying with the mask with their staff and with their customers?
So I'll take the first part of that, Joshua. So we do work closely with the sheriff's office. Obviously, they fall under the county, even though the sheriff is an elected official. I actually convened a meeting with the sheriff's office, Winston-Salem PD, public health officials, in one of the chief district attorneys several weeks ago to talk about the enforcement side and to really find out what's happening boots on the ground as we're receiving complaints in public health, and obviously law enforcement's receiving complaints. And so the general consensus is that there's more like education outreach that's happening, not necessarily a lot of enforcement, but that was prior to the city of Winston-Salem's mayor's order. So I'm not sure if there's been more of an update from Winston-Salem PD since that time. In terms of Louisville, I don't know, Joshua, do you know if there's been any specific complaints on businesses in Louisville? I think, in general, for all businesses, some are good, some are not. But I can't think of specifically, I know that there was a restaurant that was of a concern in Louisville, but I'm not sure of any others. Joshua.
Yeah, so yes, we educate individuals and corporations that when we get complaints, and we have had some in Louisville, but we've had them in Kernersville, Winston-Salem, Walkertown, throughout the county. So yeah, there have been some complaints from the public. It could be an employee, it could be a patron about some places.
But do you go back and check to see if things have changed, or do you just try to re-educate?
Well, it depends. If this is a place that we regulate as far as a restaurant, then we will make a visit and we will reach out to them to educate and make sure that they're doing the right thing. But to be fair, I mean, we are not the masked police. I mean, we're trying to encourage as best we can, and we encourage the general public, if they're in a location, to talk to the management themselves and try to educate them. And because the customers speak. So then businesses want to take care of their customers.
And just to piggyback on that, just for the general public, public health is not the enforcement authority for the governor's order. It is law enforcement. The only mechanism we have, and it's really a tall order for us to be able to prove and is rarely used, is imminent hazard, a public nuisance. And so since COVID, there's really only been two cases that I'm aware of. One is in Mecklenburg County for a church that had tons of cases and deaths associated. And another one was one that the governor or DHHS secretary did in Alamance County for the racetrack, I believe. But again, so that's, unless there was something where we could really prove there were a lot of cases, a lot of deaths associated, that's really where public health comes in. It's more law enforcement for the enforcement, but on public health side, we really do try to educate as much as we possibly can.
Thank you both.
Any other questions?
I've got two questions.
Yes, ma'am, Ms. Foster.
Thank you. As my colleagues have said, thanks for being here. I met you two at the first drive-through testing. So it looks like it was well done. I have two questions. The first has to do with the drive-through testing. Is there any feedback from the Louisville experience that you can share with us specific to Louisville? And Director Smith, along those lines, you also said you went to Kernersville and Louisville because those areas needed testing. So could you just address that? And then the second question is just, what do you need from us as elected officials?
So the first, I'll try to address those and Joshua chime in. So the reason we ended up going to Kernersville and Louisville is because we wanted to make sure that all municipalities were equally receiving testing. And so when we received our report from the epidemiologist, at that point, Louisville and Kernersville only had maybe say 10% of the population that received a test. Whereas some of the others, because we had been targeting the historically marginalized populations, and the reason for that is because that was the state's mandate. That was our priority area. So they were getting more to the 15 to 20%, and then Louisville and Kernersville was getting below. And so we wanted to make sure that we were, leveling it out as best we can for all of the municipalities. So that's kind of the reason for the testing, and we want to continue to do that and make sure that we're offering that for all of our residents. And the second part of the question, in terms of what you can do as elected officials, is really continue to support the message of masking and social distancing. I think part of it is that we have stressed masks so much, which is absolutely necessary, but mask also doesn't protect you if you're in a crowd of 100 people. So I think there's sometimes people lose sight of, well, I went X, Y, and Z and I had on a mask, so I'm good. But you were in this really large crowd. I mean, there's only so much it's going to protect you from, if that makes sense. And so it really is as simple as practicing the 3 W's will make a huge change in our community. And while, yes, the majority may be complying, unfortunately, the small minority is severely impacting our community, as well as we are approaching holiday time, really also stressing, you know, these are unprecedented times. We really need to stay in our bubbles. We really should not have large family gatherings and friends over. I mean, these are just things we can't do. I'll tell you, our case investigators and contact tracers, we are finding cases from people, you know, that's having small gatherings, 3, 4, 5, 6 people. At this point, you need to stay within your own bubble of your own family. Certainly for those who's working, you know, within your own bubble at work, wear your mask, social distancing. Joshua, did you want to add anything?
No, I would just add that we have seen this with businesses and schools, that when people, it's not at the business or at school necessarily when people spread it. It's what we're finding is that it's after hours, whether it's coworkers or, you know, your buddies come together and 5 or 6 guys watch a football game together on Sunday afternoon, or we're in some of the private schools where we've seen it's the athletics or the party afterwards after the game. So, you know, the virus doesn't care what time it is. It doesn't care anything. It's just that we have to stay diligent. And just because we're getting the vaccine, we still have to be diligent and keep wearing the mask. And anything you can do to keep banging that drum and that message, we appreciate it.
One last thing, Ms. Robinson, you mentioned that people should keep gathering to their families, and their families are folks who live within their household. That's not family who happen to come from somewhere else, is it? Because
That is correct. Your household. So for example, for Thanksgiving, you know, I was certainly not the favorite in my family, my husband and my children, but I would not allow anyone in, the cousins down the street, the mother-in-law, like, because they don't live with us. And it's not just about protecting your own family, but it's also about protecting others, right? I mean, while we are certainly doing everything we possibly can to stay safe, you never know where you may be exposed. And so the last thing I want to do is accidentally expose my 80-year-old mother-in-law. And so, yes, thank you for reiterating that, Dr. Sadler, but it is individuals within your immediate household.
I'm aware of a gathering of 14 people during Thanksgiving, and 11 of them have tested positive, and 2 of them are in ICU right now.
Wow. Ms. Hunt?
Yeah, so most of you guys may not be aware of this, but I lost an uncle last week in Eastern North Carolina to COVID-19. So we are very hyper vigilant about it in our household. Can you speak a little bit about children playing outside with friends in the neighborhood, with other friends that may be from a various household? Can you educate a little bit to the public about what that should present or look like? There are a lot of children, thankfully, that are going outside and playing nowadays, and they're doing a lot of that in our local neighborhoods. But could you talk to the families about that and how that should look like?
I'll start out. Obviously, being outside is safer than playing inside, but still, when you're outside, we need to try to keep that social distance as much as possible. And again, you know, even though because like I said, I mean, even when you get into lots of people crammed together, you're still sharing that same air. Yes, outside is safer, but safer isn't always totally safe. So I think that's something we're seeing, and that's what I would encourage. I know even myself, The other day I was on the Greenway minding my business, and I saw someone I knew who works at Baptist, and we walked, but we kept literally 7 or 8 feet apart because we were walking together for several minutes. So that 15 minutes of time that you hear, that is 6 feet apart. If you're more than 6, if you're closer than 6 feet for 15 minutes, that's indoors or outdoors. And another thing that maybe people don't always realize is cumulative. So if you're in the office and you're like, well, I didn't spend 15, I just spent 10 minutes in the morning, and then I was around him or her 10 minutes later. It's cumulative over a 24-hour period. So that's something I would say too, for yourselves, for the town, something I know in the health department, like my leadership team, I've 4 assistant health directors. 3 of the 4 are in the same building as me, but for the last 9 months, we just meet remotely. Even the one-on-ones, even though we could even keep the 6 feet, now with technology, it's almost just as good as having them there. Just to have that greater, to be safer.
Okay. Anything else? Joshua, Chantel, thank you very much.
Thank you.
You guys have huge jobs. We don't envy them, but we certainly respect the job that you're doing, and anything that we can do to help, please feel free to call on us. We've got your backs out here, so let us know what we can do. Thanks for taking time around the dinner hour to be with us.
Thank you so much.
Very good, Council. We were going to have a public safety report. I believe Hank sent out information earlier of the bulk information that PJ receives from downtown. Hopefully that was helpful for you to look at. PJ ordinarily would take all of that and cull through it and present the report that he generally does. But unfortunately, he had a death in the family. And so he has been out of town for a couple of days and has not been able to do that for us. But hopefully you'll be able to glean the information you need from the information that Hank sent. Ladies and gentlemen, this is the first opportunity in our public forum. If you'll put up the contact information on how to participate. There we go. If you are at home, you can call this phone number, which is, and I'm looking closer, as I demonstrated before, my glasses are new and they're not working very well. Telephone number is 646-558-8656. 646-558-8656. You can also go to louisvillenc.net, and you can click on residents and click on events calendar, and that will bring you to a link for tonight's meeting, and we can bring you in as a guest. So we'll wait just a second here and to see if anybody calls in or comes in as a guest. Hank, do we have anyone?
No, sir, we don't.
Okay. Very good. This is the first opportunity, ladies and gentlemen. So jot down that number, jot down that link, and we'll have another opportunity at the end of this evening's meeting for you all to ask your questions and share your thoughts with the council. Very good. We don't have no appointments this evening. We have no technical reviews. We have no preliminary site plan approvals, and we have no evidentiary hearings. So we're down to our continuation of our public hearing for UDO L162. And that has to do with the boundary maps and accepting the official map of downtown. Stacy, you want to kind of refresh us on where we are with that?
Yes, thank you, Mayor. If you'll recall, we started the public hearing for this back in November at November's regular meeting. But at the request of Dr. Sadler, I agreed it was a good idea to send out letters to those who may be affected, that their property may have been in the downtown considered that way at one time and now would no longer, be considered. I would like to report that I did not get any feedback from any of those residents. Those letters went out that same week. And then, like I said, I have not gotten any feedback from any of those residents from whom received the letters. And so if you'll recall, like we've discussed, what the planning board wanted to do was to come up with a definitive downtown overlay map. So in the future, there's no more questions in regards to, is this property within the downtown or is it not in the downtown? I know, the comprehensive plan has a preferred land use map, and that is what our existing UDO points to. But when you go to that land use map in the comprehensive plan, it's still not definitive. It's not an actual area on the legend that says, this is the downtown overlay. And within that, this is the core area and this is the gateway area. So what I'm going to do is just share with you that map one more time so you can take a look at it. The text is essentially, there's no regulations that are changing for the downtown. It is simply to update the definitions and to put into the UDO a proper place for the downtown map to be located, which is in the appendix section of the Unified Development Ordinance, and also updating the language within the ordinance, within the downtown overlay section of the ordinance that points to that map instead of pointing to the map in the comprehensive plan. So that is where the text part comes in. That's what that update is. So I will share my screen with you. Can everyone see that map in front of you?
Yes, ma'am.
The purple area is the downtown core area. The green area is the downtown gateway area. And the yellow areas are the properties who were at one time by ordinance in 1999 included in the downtown overlay that will no longer be included. If you'll remember, the planning board took a look at this, and the reason we have the Great Wagon Road on this map is because we wanted to focus primarily on those properties that front those areas of the Great Wagon Road and Shallowford Road that do not already have a specific purpose, such as single family residence, like the ones you see in the cul-de-sac on Linda Drive here in this area. Yes, they front the Great Wagon Road, but those are already established homes in a small little development. We don't foresee those being businesses. So I would be willing to answer any questions that anyone has at this time. Just so, this is what I want to show you. This is what the final map would look like. I am by any means not tied to these colors. They're just kind of colors that were thrown out there and chosen. But this is what the final map would look like. These areas would be included in the downtown overlay moving forward, if approved.
Any questions for Stacy? Stacy, I have one real quick. The two properties that were previously included in the downtown overlay, they're at Jennings Road in Louisville, Vienna, and they face Louisville, Vienna. There we go. Those properties right in there. What was the rationale, particularly the ones that are this side of Jennings Road? What was the rationale for removing those? Because there's quite a bit of business down in there.
Yeah, from what we could tell, that those properties were not essentially included in the Louisville preferred land use map. It was preferred that these properties stay residential, even though some of them, you have this light business area here, but these properties that are in yellow are zoned residential. And in the comprehensive plan and the preferred land use map that we have, from what we could tell, the preferred land use for this area was for it to stay residential. So that is why the planning board decided to take those out.
And then the two properties that are there in yellow that form kind of that little right in there. Tell me a little bit about those and why they are why they were removed.
Those are existing single family homes. Okay. Those homes front Linda Drive. They do not front the area of the Great Wagon Road. So it's pretty much their backyards that abut the Great Wagon Road.
Great, thank you.
Mm-hmm.
Any other questions for Stacy? Very good. If we can go back to our council shot, thank you. Okay. Ladies and gentlemen, this is a continuation of our public hearing. Hank, do we have anybody who has indicated they wish to speak?
Make sure, yes. No, there's no one there.
Okay, very good. With that, I will close the public hearing. Council member, it's up to us now to consider ordinance 202-0050 accepting the revised downtown.
Do we do this now or is this?
Well, you're exactly right. We got to wait 24-hour period. That's right. So we close the public hearing, and since we don't want to come back on Saturday, we will have the vote on this and our consideration on it on January 7th. Thank you, Hank.
Mayor, you may allow discussion if there is any to be before.
Is there any discussion? Very good. We'll visit this again back in January. Ms. Hunt, I'm sorry.
Oh, hold on. I don't know what okay. It just went crazy. So first of all, I just want to thank Stacy. Really just a comment. Thank you, Stacy, Planning Board, and all everyone that has taken the effort to review this and go through this. I know it's been very labor intensive. So I appreciate that and just wanted to just make that comment. Thank you.
Thank you, Melissa.
Anybody else before we move on? Very good. And we will have additional consideration and voting on this at our January 7th briefing. Ms. Walker, you have a certificate of sufficiency for a voluntary annexation.
I'm sorry, I keep forgetting that my mouse is not working and I'm trying to work with a mouse here. Yes, I had provided to you, if you had an opportunity to take a look at your packet, I had provided the information on the request for that portion of property at the end of Dab Road. And I believe I also provided the map that goes along with it. I have done the research to determine that the requestor is actually the owner of the property, and I have signed off on the certificate. Do you have questions about that request for the annexation?
Ms. Walker, what's our procedure here? Do we
Just accept my report, and normally at this junction, council would say, okay, I'm ready to set a public hearing. However, I have to work in conjunction with our planner on another part of this, which is a development. And I am not going to ask council to set a public hearing until I work with Mrs. Talbert to see what the planning board is going to do first.
Mr. Franklin. Good. Ms. Hunt, I think I saw you wave. No? Okay. Very good. Then I guess, Ms. Walker, what we as a council should do this evening is accept the certificate of sufficiency. Do we do that by motion or we do that by acclamation?
I'll ask our attorney, because normally you all just say we'll set a public hearing. So this is a little different.
Yeah, we're not setting a public hearing. I think a simple motion is probably best to accept the certificate of sufficiency.
Very good. Council members?
So moved.
Mr. Franklin makes the motion.
Second.
Ms. Foster makes the second. Any further discussion? Mr. Smitherman?
Aye.
Ms. Welch?
Aye.
Ms. Hunt?
Aye.
Ms. Foster?
Aye.
Dr. Sadler?
Aye.
Mr. Franklin?
Aye.
Mayor's aye. That's unanimous. Thank you very much. And we look forward to having a public hearing to welcome you into our town, as we always do. Ms. Foster, I believe you have asked for this next item to be placed on the agenda. This is kind of an update on your project with the boards and committees.
Sure, thank you. Yeah, just briefly, we had indicated that we would be sharing with council where we were when the December meeting rolled around. So we wanted to do that. And also, if we've got board and committee members watching, we wanted to at least forecast for them what the plans are for the survey. So two issues. One, prior to COVID, just as a reminder to everyone anyone where this might be new information, we had talked at the retreat last year about how important boards and committees are, came up with an interest in assessing their perceptions, their experiences. How are they feeling about serving? How are they feeling about the process administratively, procedurally, communication-wise, et cetera. So after a long process working with the manager, Hank Perkins, Stacy Talbert, planner, Joyce Walker, town clerk, and Jeannie Taylor has plugged in as well as communication specialist. We've developed the survey instrument questions. We've run them past you all, gotten feedback from most council members. Thank you very much. And the next step is to finalize that instrument. And the instrument's going to be very user-friendly is the intention, with lots of different types of questionnaires, probably pull-down menus. People can use it on their, hopefully, devices, whatever is easy, very user-friendly. And we expect to get that feedback by call it a month from now. So by the time the retreat rolls around, we will be providing you all with some collated information to say, here's what your boards and committees are saying. Here is their experience. And we also have an eye to any possible follow-ups down the road, how to use these instruments for staff going forward. And finally, just the whole policy and procedure, onboarding, orienting new members. We want to make sure that this is sort of a total holistic process. So all of that's been being done on the front end, and now it's going to sort of manifest. So survey coming out beginning of the year, feedback, submissions by or from those folks by, I think we picked January 15th. Stacy, was that magic date? And then after that, we'll loop back to council. So we're looking forward to it.
Very good. Thank you, Jean Marie.
Mhm.
Any questions? Yes, Ms. Walsh.
Yes, just wanted to thank everybody. Jean Marie, I'm sure you spent an enormous amount of time, and the others, our town manager, of course, and Stacy. So thank you. I think it'll be very helpful, and look forward to seeing the comments of these boards and committees. Thank you.
Excellent. Very good. Any other questions or thoughts? All righty, moving on. Joyce, you sent out our meeting calendar. Council members, if you've had a chance to look at it and check any conflict in dates that there might be. If there are no concerns, we will need a motion to approve that calendar for 2021.
So move.
Mr. Franklin makes the motion. Ms. Hunt makes the second. Is there any discussion? Very good. Mr. Smitherman.
Aye.
Ms. Welch.
Aye.
Ms. Hunt.
Aye.
Ms. Foster.
Aye.
Dr. Sadler.
Aye.
Mr. Franklin.
Aye.
Mayor's aye. That's unanimous. Thank you very much. Hank, we've got some trees, I believe, that we talked about at briefing that we want to go ahead and take an action on.
Yes, we have a budget amendment, budget amendment 2020001, an amount of $2,596. These are for the planting of additional trees at Jack Warren Park. As we discussed during the briefing last week, this is a long-running project of the LBC in which these trees will eventually be put up as memorials or honorariums for sponsorship by various individuals. The LBC has been working with our horticulturist, Mr. John Hanna of Ecologic in Winston-Salem. They, in the week since we've met, have refined the plan a little bit, but the dollar values have been unchanged.
Very good. And if I'm correct, Mr. Manager, these trees will join the Joyce Walker Memorial Tree that has already been planted in recognition of her Clerk of the Year in North Carolina.
That is correct. Miss Walker's tree was actually the first of these trees in the plan that was planted at the time that she got her award.
It is still alive.
Yes, we do that by keeping her away from the park.
Good. Mr. Franklin.
Yes, quick question. And I think I asked this at briefing. If you give me the answer, I apologize for not having it. But this phase, this 2596, how many trees is that for this phase? And I know it's starting, and this will be a recurring thing that will.
I believe there are 10 trees in this phase, and they're going to be strategically located to go along with benches to allow people to rest at various locations around the trail.
Okay, thank you very much.
You're welcome.
This will be fabulous in about 10 years when those trees are tall and have foliage, and it is enhancement to our park course, but it's also going to be a great enhancement to our walking trails. So we're planning for the future. Is there a motion, please, to approve this ordinance? Mr. Smitherman makes a motion. Dr. Sadler
Make a motion, as long as we plant the trees far enough from the sidewalk that we don't have to shave sidewalks in the future.
That is the plan.
Very good observation, Mr. Smitherman. Dr. Sadler makes a second. Any further discussion? Mr. Smitherman.
Aye.
Ms. Welch.
Aye.
Ms. Hunt.
Aye.
Ms. Foster.
Aye.
Dr. Sadler.
Aye.
Franklin.
Aye.
Mayor is aye, and that is unanimous. Thank you very much. The next couple of items on the agenda, particularly this next one, really kind of was reinforced by our presentation this evening from Joshua and Chantel. We've often questioned ourselves. I know Ms. Foster and I have had a number of conversations about what can we do to emphasize the fact that this is serious stuff that's going on, and can we as a town, can we as a council do things that will remind our residents that they need to mask up, they need to social distance, they need to do the things that are going to keep us all safe. What I'm proposing for your consideration this evening is to produce a series of videos that we'll show on TV6 and on Facebook, on our website, that basically is a Mask Up Louisville. And these would be, without getting too detailed in the production of it, these would be shots of our residents wearing masks, giving us a thumbs up saying Mask Up Louisville. And we would do these as quickly as possible so that we can maybe have 10, 15, 20 different, maybe even more than that, of our residents, and do them in short segments so that they can be shown every 10 minutes or so on TV6. But I wanted to bring that forward to you for your consideration. Hank, you've checked with Ryan Reedy about producing these. Did we get a number from him?
Yes, we did. Pam and Stacy received it this afternoon, this evening. What we expect from what we described to Mr. Reedy is that we'll do these up to 20 stitched together in a video with probably a music background, a title page on the front end with an acknowledgement on the back end. That expected cost would be around $300 per production.
Great. So first one is 300, and then if we want to do an additional one with another 20 people, it's another 300.
Yes, that's what we're anticipating.
A bargain at any price.
Mm-hmm.
Any thoughts, council members?
Clarification there.
Yes, sir.
It's $300 a pop for a video that has 20 people, up to 20 people, and that can be broken up into little segments to run every 10 minutes. Is that what you're saying?
Yeah, Fred, you and I are on the same wavelength on this. I don't think we're going to produce a 20-person video that goes on for 4 or 5 minutes. These are 30-second bursts, and they open with a slide, they close with a slide, and they have 4 or 5 people, and then we run them with frequency during the hour. You and I are in the same place.
But we're going to get like 20 of those for $300.
Well, we'll probably get 5 or 6 for $300.
What Mr. Reedy gave us was the idea we run 20, so 5 is well within that range.
A total of 20.
Well, no, I think what we talked about was originally doing about 20 a shot, but certainly 5, you're right. If we're going to hit them for 30 seconds is awfully long to stare at a picture of somebody. Yeah, so we were anticipating these shots would be someone in a mask, smiling, thumbs up, maybe a few seconds apiece, and scrolling through about 20 shots.
Yeah, if the council will grant an old art director a little leeway on this, I'll work with Mr. Reedy to make sure that they're effective. Ms. Hunt.
Yeah, so you guys heard me ask the question earlier. I've got young children between the ages of 7 and 13, and as a parent of younger children, that is something they're going outside and they're playing. Is there any way that we can get shots of these children in mask or something of that nature to also encourage parents, younger parents, and as they're seeing their children playing or something like that? I would just kind of plea with you guys, as we're having these younger children, it's really difficult as parents to they're hearing the message, but it would be really cool if they saw the message from other children.
Right. It sounds like this is something that's going to be popular. We will need to get a budget amendment together to make this work financially.
Okay. If it's within budget, obviously.
Oh, I know. Yeah, I think it's fine. We're envisioning even, we talked in staff a little bit too, that even if we're going into businesses and we're catching a one-off of somebody that is willing to have their picture taken, leaving a grocery store or whatever, you could go in and have a picture even at a local business where you could get 5 people in a shot at a hair salon getting their hair done while the employees are masked up, whoever is the patrons are masked up. Certainly then if people are willing and able to recognize the places that they're seeing, then that's an added benefit to people to do some place making with this being in our community as well.
Great.
I would certainly give latitude to what did you call yourself, Mr. Mayor?
A former art director at an advertising that should go unnamed.
Former, okay, that. Yes, and I think getting creative and letting this get some momentum around, maybe people want to go on Facebook and create their own. Hey, I'm masked up, Louisville.
There you go.
It's not going to cost anything. So let's.
There you go. Mr. Franklin.
Yeah, I don't know if this is appropriate or not, but I agree with doing this wholeheartedly. But my question here is, can we, by consensus, go ahead and give Hank a certain amount of authority and latitude for the contingency that he can tap to go ahead and make this thing happen virtually, rapid fire, and then come back and report to us, and we do whatever necessary budget amendments at that time?
Well, let me
Yeah,
ask
that's a
him,
great
I think
idea,
I
Mr.
understand
Franklin.
what you're talking about, to go ahead and see if we could operate out of contingency and then bring you a replacement budget amendment. Pam, would that work?
I'm not sure that's really the nature of contingency.
Yeah.
That's the reason I asked the question. I was just thinking, if we can go, I hate to wait till January to start something like this.
That's
The
right.
problem with
I
that is
just like to get it going,
I think the problem is that we don't know what our limit would be. In our minds, we might think you're willing to give us $1,000, but then we come back, we spend $1,000 out of contingency, and we come back and you say, oh no, we don't want you to spend that much. So,
Well, I heard a figure of $300 a few minutes ago, and I tried to question exactly what we was getting for that.
Yeah.
But I'd be willing to go 3 times that much, which, to put it ballpark figures, $1,000, and just to get it rolling.
Yeah, I think what we were originally envisioning when we were discussing this is that we do this periodically, maybe a couple of weeks apart, where we end up getting a different run of different folks.
Okay, so you're thinking $300 to cover the first run now?
I would think so, yes.
Okay.
Yeah, certainly that much.
Folks, if we can't find $300 in a $4.5 million budget, I'll be glad to write it.
Well,
Absolutely.
I just want it to happen in an, next.
I agree with you, Mr. Franklin.
Yeah,
Absolutely. We will make it happen.
Yeah.
So I guess, Mr. Franklin, I'll just kind of take your lead on this one, that I'll make a motion that we approve up to $500 to be spent for the first series of mask ups for Louisville.
And I'll back that up with a second. Yeah.
Very good. Any further discussion? Mr. Smitherman,
so that is a budget amendment.
pardon?
So that is a budget amendment.
If you would like it to be a budget amendment,
All right,
we will
so
call
are we
it
doing
a budget amendment. Mr.
I think
Franklin,
Pam
will you
is
accept that
asking,
as your second?
are you asking this is a budget amendment right now, Pam?
Yeah, I'm asking, are you voting on a budget amendment?
And we're just voting on to spend the money.
Well, that's a budget.
It'll have to be in the form of a budget amendment.
Okay, so I'll amend my motion to make it a budget amendment. Mr. Franklin, will you accept that language in your
I
second?
certainly will. Yes.
Very good. Mr. Smitherman,
Aye.
Mrs. Welch,
Aye.
Ms. Hunt,
Aye.
Ms. Foster,
Aye.
Dr. Sadler,
Aye.
Mr. Franklin.
Ah,
Mayor is aye. Thank you very much, ladies and gentlemen. Sometimes we just feel helpless because we see this issue and it's so important in our community, and we keep asking ourselves, what can I do? So thank you very much for stepping up, and let's give it a try and see what happens. The other thing, just for information, we've asked PJ to check with the sheriff to see if our community police officers can't be a little more, we'll say, aggressive in the education of folks, where they will get out of their cars a little more and walk into businesses and walk into other places. And if they see folks without masks on, not to give them a ticket, not to write them a warrant, but just to say, it's important you wear a mask. And I think that kind of reminder from a deputed officer or a uniformed deputy may have some impact, and they'll carry some masks with them to give them if they so choose. Hopefully we'll do our part. Thank you, everybody. Items D and E in your briefing packet. Item D is the resolution for the agreement, memorandum of agreement with the school system. I think we talked about this earlier, that the obligation of the town of Louisville is to provide the space. There will be an organization, and we think it's going to be the Interfaith Council, who will provide the volunteers, provide the cleaning, provide all kinds of everything else that it's over and above the space. The school system will provide the tutor. This MOA outlines that, so it's specific in writing, so everybody knows what their responsibilities are. As a side note, I did talk to our janitorial service, and they said they will provide free all of the cleaning supplies that we need for the remote learning center. And if there should happen to be a COVID case, they will come in and do the disinfecting for free also. So I appreciate that. And Ryan, if you'll pass along that to our cleaning janitorial service, tell them we appreciate it a lot. Any questions on the, I always want to say a memorandum of understanding, because that's what we call it, but MOA. Any questions on that?
One quick question, Mike, Mayor, you said that, so the cleaning personnel are going to do the cleaning. When you said the interfaith volunteers, they're not going to clean our.
Yeah, the interface volunteers will handle the cleaning. The
Yeah,
janitorial company will provide the supplies.
Okay.
And they'll be trained on what to do. Any other questions? Yes, sir. Oh,
Just very briefly, this memorandum of agreement is one that was crafted originally for organizations that had their own space. And so that is why you'll see the next resolution. But you'll see a couple of things there if you look carefully at the agreement. One of them is it says it's going to be running from August of 2020 until June 30th of 2021. Obviously, that will not be the case for this one. Also, you will see reference in the memorandum of agreement that the organization, whether it's the interfaith organization that we're talking about or whichever one that is, it refers to its facilities. And based upon that, that is why you're going to see another resolution with regard to a lease. So that will allow that reference to be accurate, because the entity is going to lease the premises at no rent from the town. Again, assuming that this is approved. Both of these agreements that have been prepared, the one by the school system and the other one I prepared, do have indemnification language for the town, so that the town will not be responsible in the event that there are any issues related to COVID.
And just for the public, no one else is going to be utilizing this facility other than these individuals, correct?
during this period of time, that's correct.
Right.
Yeah. Any other questions? Very good. We'll entertain a motion. Mr. Smitherman makes the motion.
I'll second.
Mrs. Welch makes the second. Any further discussion? Mr. Smitherman,
Aye.
Ms. Welch,
Aye.
Ms. Hunt,
Aye.
Ms. Foster,
Aye.
Dr. Sadler,
Aye.
Ms. Franklin.
Aye.
The mayor's aye. That makes that unanimous. The second resolution is our lease. And Bo, I believe you just explained that briefly, but this will be the lease with the organization that will be providing the volunteers, and they will have responsibility for the space. Any questions on the lease? We'll entertain a motion.
Move approval.
Dr. Sadler makes the motion. Mr. Smitherman makes the second. Any further discussion? Mr. Smitherman,
Aye.
Ms. Welch,
Aye.
Ms. Hunt,
Aye.
Ms. Foster,
Aye.
Dr. Sadler,
Aye.
Mr. Franklin. The mayor's aye also, and that is unanimous. Thank you, folks, for all of your input on this and for your consideration on this. We recognize that we have some parents who can't afford to send their kids to some of the more expensive remote learning places that are charging up to $225 a week. So this will provide a wonderful resource for our residents who are here locally that may find themselves needing to go to work and have a place to have their kids go during the school day. Hank, this will be the briefest report on our agenda. Upcoming events at Shalford Square.
We've got 3 things to mention, and these are all town closings. We will be closed on Thursday, the 24th, and Friday, the 25th, in observance of Christmas Eve and Christmas Day. And then moving forward, I'll go ahead and mention we'll be closed as a town on Friday, January 1st for New Year's Day. And that is it.
Thank you. Hank, would you like to report out the actions we took at our budget meeting last week?
Well, I do have one thing that we want to acknowledge. Stacy Tolbert has got an unplanned update. We were discussing a timeline earlier this week and realized that it's something that would be good and beneficial for council to hear. It'll be brief.
Wanted to let you guys know that the RFQ for the joint plan, comprehensive plan and Parks and Rec master plan has gone out. The due date is actually tomorrow at 5 o'clock. And so I have talked to some consultants. I am excited to see what we get. One has actually already came in. It was here when I got here today. So I just wanted to go ahead and let you know that we will be working on shortlisting those. Getting out proposals for them to come back so we can actually choose a firm. And we hope that at the briefing next month that we will be able to, have some information available to you in order to let you know who the firm would be, who we've chosen for that. And then at the regular meeting, we hope to sign a contract so we can get started. We hope that the work will act with the consultant will start February of next year. So
That's great. That's great news. Thank you, Stacy.
Thank you.
Okay. All right, moving forward for approvals at briefing and action meeting December 3rd, that was last week. We had approval of ordinance 2020049. This was the public hearing for UDO L161 Pedestrian Connections Overlay District, Chapter B, Article 2I of the Unified Development Ordinance, amending waiver requirements and providing for alternative compliance. And next and lastly, we approved resolution 2020078, approving new copier lease agreement with Sharp Business Systems. And that concludes that report.
Excellent. Ladies and gentlemen, these are items that we take at our briefing. Occasionally we'll need to take actions, but we like to report them out at our regular town council meetings. So you can be aware of all the actions your council takes. We are at the time for the second opportunity for public comment. If you'll flash up the how-to. Very good. Folks, that phone number is 646-558-8656. In New Jersey, it's 846-558-8656. And if you want to go to LouisvilleNC.net, click on residents, click on events calendar, and then click on the link to today's meeting. Mr. Manager, do we have anybody wishing to speak at the public?
Yes, we do have someone in attendance. We'll need Mr. Schroeder to raise your hand and indicate your desire to speak if you so do wish to speak. Stacy, in case Mr. Schroeder is unable or unaware of how to do that, can we review that for him?
He left.
I think.
Oh, he just left.
I was
All right.
going to say, I think
Answer
it's
that.
*9 to raise your hand, but I am not 100%.
Good. Well, Mr. Schroeder, we hope you enjoyed the show so far, and hope you'll come back. Anybody else, Hank?
No, sir, there are no other people.
Very good. Ladies and gentlemen, if you're watching and wish to submit written comments, you can do that to townclerk@louisvillenc.net, townclerk@louisvillenc.net, and we'll always make those comments part of the record. Council members, any discussion before we go into closed session this evening? Mr. Smitherman.
I would just like to say thank you to all our staff and everyone that has done such a great job this year, because this will be the last time that we'll have council together before next year. But thank you all for everything you've done. I hope that you and your families have a wonderful Merry Christmas and a happy and safe New Year. And again, thank you for all that you do for us.
Being the thoughtful person you are, Mr. Smitherman, I'm sure you spoke for all of our council members in expressing those thoughts. We all concur. Any other council discussion? Dr. Sadler.
I had a question. I think we approved a staff recognition and also something for the deputies. And I just wanted to make sure that, and I'm sure it occurred, that there was that the sheriff doesn't have any particular guidelines that they have to follow if they're going to congregate for whatever recognition they have over at the annex.
Thanks for letting us know that.
I'm sorry, Hank, please say that again.
I assume Mr. Sadler was letting us know that was the sheriff's standpoint.
No, I'm not. I'm asking.
Oh, okay. We don't know that either, so we are going to recognize them by individual cards so that they can go out and get their own meals.
Okay.
And Hank, the staff is going to do what?
We're bringing in a socially distanced meal. I'm not familiar yet what location has been chosen. I believe, Pam, we have a date for that, so we're set for it for, I guess it's in the next week.
It's December 21st.
Very good. Well,
Hank,
again, I wish we. Go ahead, Mr. Franklin.
Yes, sir.
I'm sorry, Hank, did I hear that you're getting some gift cards for meals for them or something for the deputies?
Yes, sir, we are.
And I mean, can you elaborate a bit more?
It's going to be like a prepaid debit card where they can use it in whatever location they wish.
Okay, all right.
Very good. I know this is a special time when historically we've gotten together with staff and our officers and our council members, and we've had a wonderful time for fellowship. I'm going to miss it this year. I know all of us who participated in the past are going to miss it. It's a great time for all of us to recognize just how important we are to each other. So Hank, if you'll please express that again to our deputies, and certainly the staff just heard me, or the rest of the staff, please express that. That would be very much appreciated.
Yes, sir.
Very good. Council members, any other comments?
My comment is queuing up the closed session and the request I have about that.
Very good. Ms. Foster, you're queued up.
All right. So we're scheduled to go into closed session for discussion of personnel issues. I'd also ask that we have an opportunity for follow up on the attorney-client privilege discussion from the briefing last week.
Mr. Attorney, any problem with that?
No, I can state what the motion would be, followed by somebody saying so moved. This would be a motion pursuant to North Carolina General Statute, Section 143-318-11A3 and A6. A3 being to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body, which privilege is hereby acknowledged. And then under A6, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee.
Very good. With that, we'll entertain a motion to go into closed session under those conditions.
So moved.
Mrs. Welch makes the motion. Ms. Hunt makes the second. Any further discussion? Mr. Smitherman?
Aye.
Ms. Welch?
Aye.
Ms. Hunt?
Aye.
Ms. Foster?
Aye.
Dr. Sadler?
All right.
Franklin? Oh, didn't hear you, Fred.
Whoops,
There we go.
okay.
The mayor is
I
aye.
thought I was unmuted. I wasn't sure there.
Ladies and gentlemen, we are going into closed session. We don't know how long we'll be. I'm guessing it's not going to be very long. We will have an action that we'll take as a council coming out of this. So if you would like to stick with us, we'll be back here shortly. And Hank, I think you've got to turn us off, and then we'll be able to take a couple of minutes while you're doing that.
Yes, thank you.
You're back on, and
All right. 1 second. Let me restart Facebook. I think it's
okay. If you were just watching on TV6, ladies and gentlemen, you got a great nostril shot of me standing up. Not very flattering, I'll add.
I'm not talking.
That's right. Let us know, Hank.
All right. Just 1 second.
We're now streaming.
Now I'm going to unlock it. There we go. we should be good to go.
Very good. Ladies and gentlemen, thank you for your patience if you're still with us. We had a closed session to discuss several things, but one of those items was the manager's compensation and performance for this last year, 2019 through 2020. The council, the administrative group, which is made up of Dr. Sadler, Ms. Foster, and myself, made a recommendation to council members that we provide a merit bonus of 2.5% of his salary for his previous year's performance. That equates to roughly $3,072. Will be paid to him as a one lump sum. It was the unanimous recommendation to do that. But we do need to have that motion in public. So council members, if anybody would like to make that motion.
I'll make it.
Mrs. Hunt had her hand up first. That's okay, Ms. Welch. You can do the second.
I'll do the second.
Ms. Hunt makes the motion. Ms. Welch makes the second. Any further discussion? Mr. Smitherman?
Aye.
Ms. Welch?
Aye.
Ms. Hunt?
Aye.
Ms. Foster?
Aye.
Mr. Franklin?
Aye.
Dr. Sadler?
Aye.
Mayor is aye also. Mr. Manager, let us express on behalf of the council and our administrative group that we are very fortunate to have you as our manager. You're doing the town a great service, and you're a great support to us as a council. The indications from the feedback that we received from all council members and others is that you're providing good leadership for our staff. So I hope you'll stick with us another year or two.
Thank you. It's been a good year.
You gotta stick with us at least one more year because that's your contract. And and breaking that, we take your first warning. Mr. Franklin?
Yes, Mayor, will the overall compilation of the council members' thoughts and so forth be reviewed with the mayor? Excuse me, with the manager, and he have an opportunity to look at what folks have written?
Yes, he received all of your comments, had an
Okay,
opportunity, and we'll have another opportunity to discuss it. But yes, he received all those comments along with the
that's
discussion.
good. Yeah, that's good. Thank you.
Very good. So ladies and gentlemen, Ms. Hunt.
Sorry, another comment. Tonight's my comment night. I just wanted to take a time as being kind of a newbie on the board and on town council, and just thank you, Hank. It's a pleasure to work with a town manager that's a veteran like yourself and that has got the experience. So I've come into this a good time. So thank you for the leadership and guidance you've given the staff and answering my questions as I've had them. Thank you.
You're certainly welcome, ma'am.
Very good. Anyone else, council members? Mr. Franklin?
Yeah, it's been a year, guys, and Melissa, Jean Marie, David. I wish I could have gotten to know you a whole lot better during our first year of our term. But under the circumstances, it's been interesting. And Ken and Jane, I've served with in the past many years, and of course with Mike and so forth. But to the newbies, it's been interesting, and I really wish that we could be sitting beside each other, so to speak. And hopefully, as we roll into 2021 and so forth, we'll have those interactions a little better. And happy holidays to everyone, and to your families. Stay safe.
Thank you, Fred.
Council members, anyone else?
I'm all heart. I'll go for it. Yeah, it's been a year, and I want to just start by saying, and I was going to say a little bit earlier, but Mayor, thank you. You do a whole heck of a lot, and whether it's talking to Winston-Salem, Forsyth County schools and trying to create some kind of an opportunity for less fortunate kids. We recognize you're behind all that and moving and shaking, and yes, Santa. Thank you for what you do and your leadership and just trying to stay ahead of so much. So you're very much appreciated. So that's number one.
We do it together.
We do it together. We do. And secondly, I ditto what Fred said, and this is a little, I guess, to the public a bit. This is hard work. I've served on the planning board and been involved with the town for a while, and this is my first rodeo with being on council and elected official. And it's humbling to know, well, here's what I don't know. And how does this work? And just sort of trying to make sure you're doing it right, but also advocating for the public and residents and asking questions, but not trying to hold up process and getting like, oh boy, Jean Marie, what is she saying? So I think we all are trying our best, and I appreciate having the wisdom and the leadership of people who have served before. I appreciate people who are fresh and courageous and asking questions, and I will just continue to try to do my best to thread the needle. And I'm always looking for feedback. So if I'm doing something that you think I could do better, I'm all ears. So thank you, Hank, too, for threading the needle of trying to serve a lot of masters. And I appreciate the staff and the residents, and we've got a great little town. I look forward to 2021.
Anyone else?
Yeah, I'd just like to say as well, Merry Christmas to each of you. And I know it'll be so hard not to be with your families, but no, you're certainly in my thoughts. And tell you what a joy it is to serve together. How wonderful it is to have a group of fellow council members and staff that you can say your opinion, whether it's popular or not, but you'll be respected. And I thank you for being who you are.
Thank you, Ms. Welch.
One last question for the mayor.
Yes, sir.
And the manager. Mike, with your hat on, I'm assuming no news from Santa is good news from Santa.
My understanding is that we're okay.
All right, that's cool, man.
We haven't heard,
We'll
we haven't
leave it
heard
at that.
that was an issue, and he's now in the 8 days or 7 days, so we should be fine.
All right.
Absolutely. Yeah, that's the gift that keeps on giving.
And boards and committees, I didn't mention them, but Mayor, I'm sure you will wrap up with everybody who supports what we do.
Well, thank you, Ms. Foster, for that segue, because as I said earlier, we do it together. Our staff, our council, our boards and committees, we're a truly unique town. Not many places have that kind of cooperation and collaboration that we do. We're embarking on an immensely exciting year in 2021. We've got a new middle school that's opening. We got a fabulous community center that's going to be just the diamond in Louisville. We've got a lot of challenges in front of us. We have a healthy budget. Thank you, Pam Morrell. We have a lot of really, really good things. Mr. Moser, thank you very much for stepping into the shoes of Public Works Director. Every day we see growth in your position and your leadership. And there's so many other folks. We have Sharon in our thoughts and prayers. She had a surgery this last week and is recovering, but she is still in ICU. So our thoughts and prayers are with her. We did lose a wonderful friend in George Hauser this last year, and somebody who was with the town for a long time. So it was somewhat of a bittersweet year. We gained some great folks, and we lost a couple of good folks. As we look around town, a lot of those folks that Fred, you and I and Ken served on council with in the very beginning, and that were an integral part of this community, they're passing. And it's a legacy that we'll remember, because they are the ones and we're the ones that have to continue to remember what Louisville was founded on, why we were chartered, and why we want to maintain our small town. So with that, folks, I will say to you, Merry Christmas, Happy Hanukkah, Merry Kwanzaa. I hope that all of the rest of your year and your holidays are happy, and you have a wonderful, wonderful new year. Hug your families, folks. With that, we'll entertain a motion to adjourn.
So moved.
Mr. Frankel makes the motion, and Mr. Smitherman makes the second. Any further discussion? Very good. Mr. Smitherman.
Merry Christmas.
Ms. Welch.
Merry Christmas.
Ms. Hunt.
Aye.
Ms. Foster.
Aye.
Mr. Franklin.
And happy holidays.
Dr. Sadler.
Merry Christmas to all, and to all a good night.
Woof, woof. Everybody take care. Stay safe. We're adjourned.
Oh, thank you.
Good night.